president at a time when the country is battling to think like Ebola could be water.
Yes, but Ebola took us by surprise. We were unprepared, both as Sierra Leoneans and in the international world. But my role was simply to complement the president and the ministry of health. So it was very simple for me to identify areas of intervention.
Okay. There were times when I saw distributions taking place of relief items, you know, and to many who saw you doing that, they were of the thinking that the First Lady is up, being the mother of the nation. That was instinctive, but it was also a role expected of you. Money side was another thing, and to put so much together at so short a time must have been tasking.
Yes, at the onset of the epidemic, I wrote to First Ladies all over the world. I wrote to international companies, NGOs, local and international ones, private partnerships, informing them about our predicament and how I could mobilize resources, materials, equipment, or even manpower. So it was very easy for me. They trickled in, but some contributed meaningfully.
We also know that you have a huge interest in the girl child, a very huge interest. And this is a time when most of them are home.
Yes.
And we've been getting reports that in the process, they're becoming pregnant. What plans are there at a time like this, when the country is slowly recovering? What are you going to do as your intervention in order to have those girls become what they may have become had they remained in school and not out of school due to the Ebola epidemic?
This saddens my heart, and is one of the difficulties we have encountered as a nation. It bleeds my heart to see teenage pregnancy on the increase. I've done a lot of advocacy work reducing teenage pregnancy in Sierra Leone, but all of a sudden, due to closure of schools, some children have wasted their time and have run to the wrong direction. So for us, the Ministry of Health is informed. The Ministry of Sanitation, Gender and Children's Affairs have been involved. We have sent the primary PPAs and what's the other, Maristopes. They've all been to them. They've educated them on family planning issues. They have been given a choice so that these children will take care of themselves. Even though we've had radio and television programs, it is not reachable in some parts of the country. And parental supervision also plays an important part. Some parents have not really supervised their children. So for us, we are trying to get them back to school again, support them, provide scholarships as usual as we've always done, but just encourage the girl child to stay in school. The Ebola outbreak, if unchecked, will reverse all the gains we have achieved. And one of the things that bleeds my heart is teenage pregnancy going on the increase.
How do you think these young girls who will eventually become teenage mothers make themselves citizens of importance, citizens that the country may be proud of? It may be said they ran out of the rails, but they will be re-railed again, and the future continues to be bright.
It is a hard work. I've always encouraged girls to stay on in school. We want girls to be highly educated. We want our girls to maximize their potentials. So staying on in school is the best option for them. Earning themselves a trade is another option. But whatever it is, they must be economically independent to look after themselves.
What was it like to be in the country at a time when it looked apparent, in fact obvious, that Ebola was on a slow movement from one side of the country to the other side?
Well, Val, that did not come as a surprise. Ebola hasn't got legs to walk on. But if people are moving unchecked, it is bound to happen. If people do not obey the rules of not touching, rules applied to washing of the dead, not touching the sick, it was quite obvious that there will be an increase in the outbreak. So for me, initially there was a lot of myths, misconception, denial, lack of education. People did not really appreciate the gravity of the epidemic. So it took them time to realize that it was a deadly disease.
And we have seen you hosting international people with a huge interest in what's going on in this country. You know, usually when you speak to them, as the mother of the nation, what are your conversations like in terms of fighting what's with us and the future that is to come in the wake of Ebola?
Well, it depends on which perspective you're talking from. From a health perspective, it was easy for me to talk to health professionals about building the capacity of our nurses, strengthening our health system. I advocated for triage nursing, which is now very popular in all the epicenters and isolation places. It was very easy for me to talk to even the donors on the importance of infection control. The PPEs that is very popular nowadays, I was very vocal because being a nurse myself, it was easy for me. And then we advocated for medication to be in this country, equipments, the thermometers, the infrared thermometers. We made a massive drive for medical and non-medical items, even food supplements, well, to support the welfare issues of mothers, children, and even isolation households.
Now, let's talk about ignorance. What role would that play in the aftermath of Ebola? Because what is seen right now is the fact that Ebola is on its way out. But there are stories of the recurrence of such epidemic in countries where it has occurred before. What role must people in the health sector and the country as a whole play to ensure that a recurrence is made impossible, or where it becomes a possibility, it is nipped in the bud?
Well, social mobilization must continue. The advocacy must continue. I have worked currently with all sectors. I've worked with traditional religious leaders. Now I am working with cultural leaders, because these are people who are entrenched in customs and traditions. They have a lot of attachment to washing the dead and touching the dead. So we have created champions who will be equipped to educate people in their communities, educate them about Ebola, about prevention, and how early detection saves life. Another program I'll be embarking on is early warning signs or indicators. That will be sponsored by Plan. There we are going to take it to the community for what you are asking now. That is my next port of call, to train the community on early warning signs or early indicators, what people should do and what they should not do if there is an occurrence of an epidemic of such.
How could this happen when the multiplicity of the signs of Ebola and is quite obvious, and the other fact to think about is that malaria, cold, and all those other tropical illnesses have signs and symptoms comparable to Ebola. How do they know the early warning signs and not mistake one for the other?
We are going to do a drive on early warning signs of any epidemic or any illness of concern. The important thing is to go to your health facility, and there the doctors or the nurses will do tests to indicate what you are suffering from. There is no way in which you can detect Ebola fever from malaria or typhoid. It's all fever and they all are temperature related. So only visiting the health facility, which is another promotion to get people to go to hospital. That's another big area. People are afraid of going to hospital. Morale is low. They think they will catch Ebola. We have workers, even doctors and nurses, who are afraid to man these hospitals. So there's a lot to be done. But we will take one step at a time to achieve our goal.
There is a spectacular move you made at the height of the epidemic, and that was to bring all traditional healers in one place. Because what too many people were saying at the time was that people who continue to practice traditional and customary means have been perhaps inadvertently spreading the disease or maintaining its steady flow. But you successfully brought them together and got them to see things your way. Usually people say, if you try to interfere with customs or traditions, there could be a backlash and a negative one as that. How come you were successful in that venture?
I was successful because Ebola has made it successful. The cultural people, be them secret society members, traditional healers or rulers, have seen how deadly Ebola is and how potent the virus is when people die of Ebola. So it was very easy for me to convince them not to touch or wash the dead. And that was the whole idea. There has been a public health ban on secret societies. It must be enforced, and whatever it takes, if you want to save your lives, don't touch the dead, don't wash the dead, don't have anything to do with the dead, call 117.
What made it easy for them not to argue?
Because of the approach, my approach. I wouldn't want to tell you all my techniques on camera. You have to be stealthy. I accepted them for who they were. I did not point fingers at people. They were educated on what to do, and no other way was accepted. So it was very easy for me.
Now, the success is being manifested with the low numbers being recorded. And now, the thinking is to get back to normalcy. The children will be going back to school.
Yes.
Being the mother of the nation, what are your concerns, suggestions, opinions on how these kids are kept safe in school until there are no more recordings of infected persons?
Plans are on the way for proper structures to be in place. Children must be spaced out. Classrooms must be chlorinated. The hospitals must have a nursing post. There should be thermometers for health checks, hand washing. The government is doing that, and it is a process. And if the process is properly working, children will safely go to school, work in school, play in school, without any fear.
Now, you're talking about social mobilization taking place by the end of Ebola. How long do you think these mobilized community could stay intact?
Well, that depends on the community. As soon as the community embraces the vision and takes ownership of whatever they are told to do, that is the only time Ebola can come to an end.
When the numbers started going down, and when it started looking like the country was winning the war on Ebola,
Yes.
what was the feeling?
It was a good feeling. I was the happiest woman. We have been grounded for months. I cannot even attend international conferences. I cannot represent Sierra Leone anywhere because of the Ebola. So I'll be the happiest woman to see Sierra Leone Ebola free so that our people can live in liberty. We can all do what we used to enjoy so that we can all move around freely without hesitation.
Those who know the smiling president of Sierra Leone saw one without the smile and they were worried. He gave a solemn speech some time ago when people were like, not even a single signature smile. What was his countenance or emotion like away from the public, speaking with you on his feelings on the declining numbers?
He's the father of the nation. He was delighted, he's happy, but he is putting parameters in place to maintain 0 cases. And that is the difficulty. When you deal with human beings, it's very difficult. Movement of people does not help issues. So the awareness and educating them about the virus and how potent it is the most important thing to do.
When Ebola was ravaging Sierra Leone, let's talk about calls you received from fellow First Ladies who were worried that their friend, Mrs. Kuruma, Sianyama Kuruma in Sierra Leone, is in the middle of a situation. Which one of those calls do you still remember?
I still remember calls from Guinea. They also had the Ebola outbreak, but the First Lady, Madame Jeanette Conde, called. The First Lady of Nigeria called, Mrs. Patience Goodluck Jonathan. The First Lady of Malaysia called. Some others wrote to me, so my friends have been supportive, like we all do. We are always concerned whenever there is an epidemic or any extraneous circumstance in anybody's situation.
In your capacity, you are one of Sierra Leone's celebrated daughters, someone to be proud of. And there are those who may want to emulate you and who may not be able to. If you were going to send a message out to those children who shall eventually become what you are, what would you tell them in order to achieve that?
I want my children to do things children are supposed to do. When you are a child, you play like a child. Let them stay focused. Let them concentrate on their education so that they'll be highly educated and look after younger children.
Do you see any post-traumatic stress kicking in when Ebola would have been finally extinguished?
Well, that has started already. Any epidemic of such nature, after any epidemic of such nature, sometimes even during the epidemic, most people are traumatized. That's why I was approached by Israel to start off psychosocial training in Sierra Leone for all walks of life. We are putting structures in place for that. Trauma goes with the epidemic.
And for those who've fallen by the wayside?
Oh yes.
What are you going to do? Because we know you have your programs, particularly for those children who do well. How would you ensure that they are brought in so that they benefit from your programs?
I cannot do it all on my own. I'll just encourage other people to partner with us, to support our survivors, support our children. Their lives need to be rebuilt again. They are part of Sierra Leone, and we should make it possible for them to overcome this stigma.
To your fellow women, what's your message?
My fellow women is to just continue to follow the ABCs, they do not touch. Let us be supportive to our spouses and partners. Let us remain as strong women folk of society, work with one another to make a difference.